This trio of bills marks the furthest any legislation has ever gone in establishing a strong, comprehensive regulatory framework for medical cannabis that the state of California needs and that it deserves. For nearly 20 years, California has allowed for the use of medical cannabis by patients with certain health conditions. However, the state has never properly regulated the medical cannabis industry. This has resulted in Californians living in the Wild West of cannabis. There are no testing standards required for medical cannabis. There is inadequate enforcement for illicit activities such as illegal grows and diversion of product out of state. The environment is being neglected and destroyed, and water has been inappropriately diverted. But with this legislation, much of that will end. The framework we have established sets up the Bureau of Medical Marijuana Regulation as an oversight agency under the Department of Consumer Affairs. Under the bill's architecture, the Bureau, along with the Department of Food and Agriculture and Department of Public Health, are responsible for all licensing, including for cultivation, manufacturing, dispensing, testing, distribution, and transport, as well as all of the related necessary regulations. They'll be preparing those as well. This legislation will solve many of the problems that we see throughout the state related to medical cannabis. Our patients will be safer because with this legislation, the Medical Board of California can crack down on physicians who are inappropriately recommending cannabis, and strict testing and labeling standards for all manufactured products, including edibles, would be required. Our families and the public will be safer because this legislation provides funding for law enforcement through grant programs to crack down on illicit activity. Our environment will be healthier and our natural resources protected because there will be funding for environmental cleanup and high standards and regulations for the appropriate cultivation of marijuana.
Medical cannabis in California has been legal for a long time, absent the benefits of regulations. And we know from our research and from our experience that sensible regulations for medical cannabis preserve safe and legal access for patients and communities. They protect those patients from harm, and they reduce crime and they reduce complaints. And so that's a win-win-win for everybody involved in the process of medical cannabis. And so we're so happy that California patients are now going to have an opportunity to enjoy those proven benefits of regulation in medical cannabis. And so we call on the governor to sign these important bills and to make that a reality in California for the patients who are counting on these regulations to ensure their safe, legal, and dignified access to medical cannabis.
These bills maintain local control. Local governments will still have the power to create ordinances that go above and beyond the regulatory floor that these bills provide for standards for the public's health, safety, and environment. I'm proud to say that in the legislature we had a strong bipartisan support for our legislation throughout the entire year, with well over 2/3 of the members of both houses supporting the measures. In addition, the stakeholders who touch all aspects of the industry, from patients to local governments, from law enforcement to medical cannabis businesses, from unions to state agencies, and more, were deeply engaged in our legislative process from the first day we introduced the legislation last December. I'm proud to say that on day one of this year's legislative session, the Assembly put a stake in the ground and said, we're going to provide the solution that California needs with respect to providing a comprehensive regulatory regime for medical cannabis, for the medical cannabis industry, and we're going to do it this year. With these bills, the Assembly has delivered on that promise. We now ask that the governor sign this critical trio of bills.